Hello and welcome to this special conversation with a jury member of ZS Prize. ZS is a management consulting and technology firm focused on transforming global healthcare and beyond. It has instituted the ZS Prize to nurture ideas which can solve some of the complex challenges of healthcare access and affordability in India at scale. And I'm very pleased to welcome one of the jury members of ZS Prize, Sandeep Singhal. Sandeep has been an entrepreneur and a pioneer of Indian venture capital. He is Senior Advisor, Avana Capital, and ex-MD Nexus Venture Partners, which he co-founded in 2006. It was among the first India-US venture funds in enterprise technology and consumer internet. Sandeep represents Nexus on the boards of various portfolio companies. He was co-founder and CEO of Medicine Solutions, a healthcare outsourcing company. He co-founded and led eVentures India with investments in customer asset, Make My Trip, and NetMagic Solutions. Sandeep, so very good to have you here with us today.
Thank you, Maloney. It was a pleasure to be here, and thank you for inviting me for this session.
It's our pleasure. Sandeep, my first question is that you have first-hand experience of working with and investing in businesses and in ideas. Now, every venture investor has their own investment mantras. So how do you gauge that this is the right business for you to invest in? And conversely, what according to you should businesses look for in an investment?
Yes, I think, as an investor, we also have a thesis of where we see opportunities in the market, where the big gaps are, where there are large market spaces for entrepreneurs to focus on. And so in the process of looking for investments, we meet many entrepreneurs in that journey. The entrepreneurs have their own vision that they bring to solving problems. And typically, you end up investing in entrepreneurs where there is a sort of chemistry between what your approach or your vision is for a particular problem and what they believe they want to solve. In our view, there are four things we look for when we are sort of evaluating investment opportunity. One is obviously the entrepreneur themselves, a team or an individual, and how passionate they are about solving the problem, how they're going about articulating the problem itself and their solution for that problem. The second area we look at is how large the market is. As I mentioned, market size is very important to us. The third area is to really think about how are you solving the problem? Are you going to spend a lot of money trying to solve the problem, or are you capital efficient in the way you do it? Are you involving the existing ecosystem in some way to make things happen and move faster? And all of those have a big role to play in the success of a business. And I think the final thing that we really look for is the perseverance and the ability to sort of keep at it over a period of time. And that comes through in the way, as I said, the team is presenting themselves in their journey. So for us, this is the way we look at it. Now, from an entrepreneur's perspective, this is a journey that they're embarking on with an investor, which could last, a few months, could last a year, could last multiple years. Typically, they have to plan for multiple years. Building a business, particularly when you start very early, requires a lot of time. What we tell our entrepreneurs is you should plan for at least a 5 to 7 year journey in building a large business. And so if you're thinking about partnering with someone for 5 to 7 years, that's like marriage. And you have to really think about, can I work with this investor? Is this investor aligned with my way of working? Are they aligned with my approach on the problem? So there are multiple aspects that the entrepreneur should also be thinking through. They should be thinking through in terms of the alignment, the chemistry, the same way that an investor would look at an entrepreneur. And that goes a long way in a success of a business when through the journey, because even when you are in good times or bad times, there are always going to be different viewpoints that are presented. And you have to be able to work through those viewpoints, particularly when they don't align. And so it's very important that the entrepreneur in some way tests the investor, right? And in that initial discussion, it's not just the investor that is evaluating the entrepreneur, but the entrepreneur that's also evaluating the investor.
Right. In this context, Sandeep, how would you see a platform such as ZS or the importance of, platforms such as ZS? Because it brings together people, from so many different backgrounds, so many stakeholders who all have, a common mission.
Yeah, I think I mentioned this in the first response when I said that we do look at how does an entrepreneur leverage the ecosystem around them. And I believe ZS Associates is a phenomenal partner to have when you're trying to address the healthcare market. The firm has a very deep understanding of the healthcare ecosystem, not just in India but globally. So they can provide a entrepreneur that's trying to build a business a viewpoint on what has worked, in previous environments. Could be in the US, could be in other markets, could be in India. So there is a lot of value that experience and the collective wisdom of the ZS team can bring to a early stage startup. So that's the starting point. ZS Prize itself is actually a process to become part of the ZS ecosystem. So what the ZS Prize effectively aims to do is to support the affordable and accessible healthcare innovations that are targeting the India market. And on top of that, ZS provides mentorship and access through their relationships that they have in the Indian ecosystem. So once you are part of this process, once you are selected to actually be, not just if you win it, but even during the screening phase and during the mentoring phase, there is a lot of value that ZS would bring to aspiring entrepreneur. We've seen this, last year when we started this, we saw the impact because we had over 2,800 healthcare ideas, that presented to us in the initial stages of the prize competition. And I think we were engaged with almost 33,000 people. These were teams, these were individuals who came and presented their vision on how to impact Indian healthcare to us. And as a jury member, I obviously saw the more sort of screened ones at a later stage. But from some of the people that I interacted with during the mentoring session, I saw that the ZS team actually was adding value even in situations where they were, the team wasn't likely to proceed to the finals or whatever else. So I think as an organization, ZS is not just providing a platform to give a prize, but is also providing a platform where their collective wisdom can be used by entrepreneurs to sharpen their business proposition.
Okay. Continuing on ZS, the central theme of ZS is solving for healthcare in India. According to you, what would you say are some of the biggest challenges? And, how do you see the role of tech impinging on healthcare? Because we're seeing, AI, VR, IoT, all sort of impacting healthcare and healthcare technologies. You've invested, in tech-led solutions. So from your vantage, what would you say are the big challenges and how do you see technology kind of solving that?
You asked the question, what are the sort of opportunities and challenges in the Indian healthcare system? We start off by basically saying India is, it's becoming the most populous nation in the world. It's the second largest, but not by not by too far. And we have a very disparate healthcare delivery network. So if you look at the sort of metros, I'm sitting here in Bombay. You look at Bombay, you look at Delhi, you look at Bangalore, and you look at the healthcare delivery that we get it's world class. We have the best doctors, we have the best equipment, we have, I would say, in some ways, better access than I would if I was in the US. Today, I can call a doctor and get access to them in a matter of a day or 2 days. In the US, my friends have to wait for 3 weeks, 4 weeks sometimes for getting access to a specialist. So on one hand, you have very good healthcare delivery in the metros, and then you go to the rural areas and you start seeing the challenges where you don't have either the facilities or the personnel to really provide, world-class healthcare services. That could be. I was recently in Orissa, outside of Bhubaneswar in the Puri district, visiting some of the sub centers, some of the primary healthcare centers, community healthcare centers, just to understand how does the government deliver healthcare. And I am very heartened by the fact that the people who are on the ground are very motivated to make things happen. When you go to the sub center, we visited 3 sub centers, and at each of those sub centers we had people who were trained in nursing or Ayush care, who were providing the service. And there was one gentleman who was actually sitting in a veranda of a sort of school, providing the service on a makeshift desk. And but at the same time, when he was treating the patients, it was with as much care as a doctor would in Bombay. It was just a total focus. And when you speak to them and you try and understand their motivation for doing what they're doing, it is amazing to see the level of the desire to do good for their community. These are people from the community who have made it their mission to bring good healthcare services for their community. And this is the same thing when we went to another where we visited. There was a nurse who was actually again providing these. These are community health officers, CHOs. And when you go up to the PHC and you go to the CHC, you start seeing that there is a pyramid of services that are being provided at each level up to the district hospital. And so the key thing for us is to actually enable this network to be more sort of cutting edge. And I think you bring up this point about use of technology. So the reason why I went to Orissa was we were actually looking at the rollout of teleconsultation in these facilities. And so we saw a teleconsult happening at the sub-center level, which was being done by a doctor who was sitting in the community health center, which was about 30 or 35 kilometers away. And similarly, there are specialists who are in Bhubaneswar, which may be another 50 kilometers away. So there is again a network being created around providing the latest technology, the latest healthcare delivery practices at the village level. And so the sub-center, for example, the sub-center we visited was catering to 10 villages. And each village had an ASHA worker, and the ASHA worker would accompany the patient to the sub-center and provide the initial sort of coordination on this process. So I do feel that there is a huge opportunity there, right? Where we have a group of very motivated people at the ground level who, if they're provided with the right tools and the right technology, can do a lot more. Now that brings you to the point of what tools and technology. You mentioned AI as one big area. I think artificial intelligence is having a big impact in healthcare, particularly around decision support systems. So you're starting to see that a person that is sitting in a more remote location is able to access a tool where they can sort of they can scan somebody's skin. They can see if there is a boil that's there, or there is a laceration that's there or something. And by just looking at it with a camera on their phone, they're able to get more information than they would otherwise. It would be impossible to have a highly trained dermatologist in that location. So how do you bring that dermatology training to that person in the village? And that's one way to do it. So artificial intelligence, in my view, has a major role to play. We've seen that also during the COVID period, where you were able to use AI for screening X-rays, chest X-rays, and being able to sort of diagnose whether the person had COVID or not. So there is a lot of activity happening there. We're also seeing automation and remote sort of monitoring coming into the wards, into nursing areas, and this is allowing nursing support to be leveraged a lot more. So a single nurse that may earlier be only able to support, say, 6 to 8 beds, can now support 10 to 12 or 15 or 20 beds, right? Because they have ability to use technology to keep track of what is happening to the patient real time. So there is automation, there is remote monitoring. We've seen remote monitoring also work in the cases of ICUs, where ICU doctor, there are very few in India. It's a very emergency care is a very scarce resource. And again, we've had doctors sitting in Delhi, doctors sitting in Bangalore that have been monitoring ICUs in remote villages in Maharashtra, remote, not villages, but I would say remote locations in Maharashtra, district hospitals in Nashik, outside of Nashik, and so on, and providing ICU services that you would get at a Medanta or at a Apollo. So there is a lot of technology interventions that are coming in. Uh, you know, the whole area of computer vision is a big area. The whole area of this is being used, for example, in diagnosing diabetic retinopathy. So there is, as you get diabetes, your retinas start to become weaker, and there is a technology which allows you to again to use your camera phone to use and to see whether the person is getting diabetic retinopathy. So again, seen a company that's working in that area. So lots of exciting things that are happening in this space around monitoring, around diagnostics, that I think will really change the way healthcare can be delivered in India if it's sort of deployed at scale.
As an investor, then, what are the kind of market opportunities in health tech and healthcare, that are exciting for you? You mentioned a few of them, in what you just spoke. And also, when you talk about delivery, we do have a long way to go in making, healthcare universally accessible and also affordable. But what are the challenges that you see from your?
So one of the big challenges that we have, obviously, is the ability to pay. Healthcare is actually one of the biggest causes of bankruptcy in many markets, India included, because the cost of procedures can be very high, and a lot of people don't address the problem at the preventive stage or at the early stage because of access issues, as you said. So if I'm sitting in a village and I have a headache, I may ignore it till it gets to a point where I cannot. And when I go to the sort of community health center, or I end up going to a hospital and I discover that I have a tumor or I have some other problem, which could have been easily addressed at an earlier stage at a much lower cost, the cost really goes up. And at that stage, it becomes effectively, debilitating financial and health event for the patient. So from that standpoint, this issue of payment is something that has to be addressed, and that is one area where I've been investing in healthcare now for over a decade in India, and that's one area where I feel there remains a big gap, where entrepreneurs really have to think through how do they show the value add in the healthcare delivery ecosystem to get paid for what they are delivering. And people don't mind paying for a hospital visit. People don't mind paying for a medicine, particularly if the medicine is being prescribed by a doctor, right? So obviously, there is an existing payment mechanism because most people are paying out of pocket. Now, if you look at more developed markets like the US or the UK and so on, where they have large payers, where they have insurance companies or they have government payment mechanisms and so on, uh, some of that problem has gotten addressed. And that problem is also obviously in the Indian context. If you go to a government hospital, that does get addressed to some extent. But there is a limitation in terms of India only has about 40% insurance coverage right now. The PMJ scheme, I think, is in some ways very important to increase that coverage. How do you increase awareness for that in rural areas? How do you make it easy for people to use that, to be able to go to a hospital to get treated, to get the insurance to pay for it, to get the government insurance to pay for it? I think those are some of the things that need to be worked through. And interestingly, I'm seeing more and more entrepreneurs building around those opportunities. So today, there are people who are trying to solve this problem using a primary healthcare solution in rural areas or say semi-urban areas, but where they are showing that there is value being provided. When, for example, again mentioning Odisha, when I went to this sub-center and I met some of the patients there, I asked one of the patients, I said, how much, if you don't come here, where would you go? And he said, some of the local pharmacists have doctors that come visit from Bhubaneswar or Puri, and they hold these clinics once or twice a week. And I said, how much do they charge for the consult? And he said, anywhere between 200 rupees to 400 rupees. So the interesting thing is, the person from the village is going to this doctor who is sitting at a pharmacy shop and conducting a clinic, 200 to 400 rupees. So it's not that there isn't a willingness to pay or there is a sort of ability to pay, but the point is that that doctor has shown that there is value being provided. Now, if an entrepreneur can do the same and they can create a teleconsult mechanism where they can provide an equal experience to the patient, that the patient leaves with the mindset that yes, I got treated, I got seen by a doctor. Will they pay 50 rupees? Will they pay 100 rupees? Will they pay 200 rupees? I'm sure they will. So in my view, the starting point is any entrepreneur that is looking at setting up a large healthcare platform should be thinking about how will I get paid for the services that I provide? How will I show value to the end patient? How will I show value to the family of the patient? How will I show value to the doctor? If I'm working through a doctor, how will I show value to that doctor? So I think those are some of the things that need to be worked through.
All right. Okay. My last question to you, Sandeep, what would be your advice to the participants who aspire to be part of the ZS Prize and solve for healthcare in India?
So in my view is, again, taking back all the points that I just brought up, I think you have to build solutions that are addressing the India market. You have to think about this from a standpoint of both scale as well as the ability to pay. You have to look at the market as a sort of graded market where you have the world-class solutions in the metros, and yet you have a dearth of access in rural markets. So you have to look at this as a very, very disparate market with a need that could be at very different points. And therefore, when you're trying to build a solution, make sure that the problem that you're trying to solve, this and the solution that you're trying to address it are aligned. It's very easy to build a gilded solution for a market that cannot pay. And so make sure that you build a solution that is right for the market that you're targeting. I think technology is going to be play a very important role in healthcare delivery. And today, if I look at it, pure digital solutions have not gotten monetized. People haven't paid for that. So you have to look at a phygital model. You have to look at an omni-channel model. You have to look at bringing technology to improve productivity, but still provide a physical sort of relationship to the patient. The patient in India in particular is still very tied to that physical interaction with a doctor or going to a hospital or going to a clinic. So I think it's very important to figure out how you fit into that overall ecosystem. And then when you are looking at technologies, again, there is increasing level of penetration that's happening in with smartphones in rural markets and more broadly. Uh, Technology like 5G broadband has penetrated, but it is still patchy. So don't depend on that as a given. Awareness is still an issue. So you may have people in semi-urban markets or rural markets with smartphones, but will they use it for healthcare? Probably not still. They are using it for maybe e-commerce. They may be using it for WhatsApp, but they aren't using it for healthcare yet. So there is a, as you're thinking about this, don't just assume that if you are sitting in Delhi or Bombay and building a solution, make sure that you are, and you're building a solution for, say, a rural population, make sure that you're with the rural population, understanding their behavior before
Right.
you do something. If you're building a solution for Bombay or Delhi or the metro markets, make sure that you are building something that can scale in those markets, that can really differentiate itself, because those are relatively small, concentrated markets.
So, digital solutions attempt to build trust, uh, you know, uh, with your customers and build solutions that can scale, build for India, and hopefully, that can service the world.
Yeah, I think, Melody, you mentioned a very important point. I don't think I stressed that. You use the word trust. And I think that's a very important thing in healthcare. And trust is built around healthcare outcomes. So I think a focus on outcomes for patients and the trust that gets built on top of that, I think is a very important part of any healthcare entrepreneur's journey. I recommend that to every single entrepreneur, that before you go and scale, make sure that your outcomes are there.
All right, Sandeep, thank you so very much. I'm sure your words will be encouraging to participants. There is a lot for them to take away from this conversation. Thank you so very much for your time and for your thoughts today.
Thank you very much. Thank you for having me.